Welcome to University Television Presents. I'm your host, Jamie Bingham. Locally founded in 2006, Stanton Healthcare is a professionally licensed, cost-free clinic for those impacted by unexpected pregnancy. They strive to provide women and families with real choices within a safe, non-judgmental environment. Stanton has received national attention, including articles in Cosmopolitan and U.S. News and World Report, due to their outstanding progress as a nonprofit organization. Today I'm joined by Stanton Healthcare founder and CEO Brandi Swindell and Director of Operations Thomas Ditaranto to talk about their Stanton Revolution and involvement with Boise State University. Hello, thank you for joining me today. So I know Stanton is doing something special at the Boise State football game next week, and we'll get to that in a few minutes. But first, I just want to talk about the clinic's daily activities. And so can you tell me a little bit about the women you're assisting and some of the amenities that you guys have?
Sure, absolutely. So like you mentioned, Stanton is a nonprofit life-affirming women's medical clinic, and we reach out to those who are facing an unexpected pregnancy to make sure that they have access to quality health care and alternatives and options in a situation like that. And it's pretty amazing because we're staffed by a lot of volunteer nurses and doctors and sonographers and trained client advocates, and a lot of these volunteers and licensed professionals have had an experience themselves with an unexpected pregnancy, and so that's part of the reason they're involved in the work that we do. So specifically, we have an 18-month program if a woman needs that, but at the very least we can provide any woman facing an unexpected pregnancy with a lab-grade pregnancy test, an ultrasound verification exam, so she can determine how far along she is, which is very key when she's trying to decide what she feels to do with that pregnancy. We can also come alongside her with information on adoption and on parenting, and we have life coaches that work with us, and we have maternity supplies and baby clothes, and the list goes on and on, just a variety of things that we can provide to these women. Mm-hmm. We also have a post-abortion care program that reaches out to women that maybe just want to have somebody to talk to about that if they've had that in their past. And so it's a very non-judgmental, non-condemning, safe environment for a woman to come to talk about such an important issue or situation she may be facing. And a typical woman who comes to our center, who walks through our doors, it can vary. It can be a 17-year-old, it can be a 23-year-old college student who's about ready to graduate, it can be a 34-year-old realtor who is at the top of her career, it can be a refugee woman. We serve a lot of women in the refugee community, and so it's very diverse, but the one thing that all these women are looking for is access to quality health care. They're looking for compassionate care and support, and they're looking for an environment that's confidential and non-judgmental. Mm-hmm. And we help them walk through the process of this unexpected pregnancy, and really our center is about providing hope. Mm-hmm.
So can you just talk a little bit? I was at your clinic and I saw you had a back room filled with baby clothes and other things. Can you just talk about like how a woman can get some of those amenities? Or I know that you have like a beauty.
Yeah, we have a wellness.
Yeah,
you saw our wellness room?
Yes,
yeah, that's
exactly.
right. That's where we met with you and gave you the tour of the center, mm-hmm. and then we sat there in the wellness room, which I'm really excited about. We just officially launched our wellness program, which involves massage therapy, and we have people who volunteer who are licensed in massage therapy and doing facials, and we can even do pedicures and haircuts. It's an actual almost salon or spa that's mm-hmm. licensed by the state of Idaho within our clinic. And imagine if you're pregnant, maybe you're feeling alone because you don't have the support of your boyfriend or the father of the baby, or maybe your parents are upset. Women can come and find a safe place and a calming place, and we really strongly believe, and I felt in my heart when I started this center, is I wanted a place that really empowered women and a place that would really strengthen women, mm-hmm. and one that would uphold their dignity. And that's part of the wellness program, is to help these women know that they are valued and that there are people that they can talk to sort of work through these issues, because we all do better when we have a support system. Mm-hmm. I mean, that's just that's evidence-based, fact. And so that's what we like to provide. But even if a woman comes in and she gets a pregnancy test with us, and we do the ultrasound exam, and she decides in her heart she wants to parent that baby, we're going to be there to stand with her. Like I said, I mentioned that 18-month program. Mm-hmm. The way we describe it is we have a toolbox of resources and programs, and we can open up that imaginary toolbox that's full of all these resources and programs, and the woman can decide what tools she needs, what programs and resources she needs to get the support that she needs during that unexpected pregnancy and even after the baby is born. And that's important because we do very individualized care for each woman. Our clinic manager and our client advocates and our nurses, come up with a plan for each woman. And even the fathers of these babies. In fact, we're very grateful to have Thomas on board because he has a tremendous amount of experience in mentoring. And so some of these young fathers it's an unexpected pregnancy for them too, and they want to try and help out and be a support, and they don't know how to change a diaper. They don't know, the first thing about fatherhood. Maybe they're feeling a little nervous or scared. And so Thomas right now is mentoring 6 fathers, 6 young new dads in our program as well.
Do you want to talk about that a little bit?
Well, yeah, we have our program basically, as Brandi shared, is we have dads coming in. A lot of times there's a lot of guilt with the fathers. They're being told, what did they do? And so, and in addition to that, dads are like, well, what do I do now? And so part of what we're doing at Stanton is basically mentoring them. Everything from teaching them how to change a diaper to what it means to be a dad, how to be in your child's life. If you have a daughter, having a daddy-daughter date time. And it's amazing how some dads, don't realize the importance of what it means to be a dad of a daughter. I had one client who was really excited that he was having a daughter, and I was happy for him. And I said, why are you so excited? And he said, well, I don't have to do much. And I said, well, what does that mean? And he said, well, mom will do all the work. And I basically said, no. If you're not in your daughter's life in a real meaningful way, she's going to find someone else to fill that role. And he was amazed. And he was a young guy, so I understood where he was coming from to some degree. But those are some of the examples of the mentoring program that we're doing with these dads. And
and it reminds me, if I can just interject, we've been given permission to share this story. We had a young father that came in, about a month ago, and we were having a staff meeting, and our clinic manager came to the back conference room and said, oh, Brandi, Thomas, you got to meet this kid, you got to meet this guy. And it was one of our young dads, and he is the full-time caretaker of his little girl. I think she's about 1.5 years now, and the mother of the baby is in prison. And so he's the primary caretaker, and he's relying on his mom, the grandma to the baby, to help him a little bit too. But he's also relying on Stanton, and he was coming in to pick up some baby formula and some diapers and a variety of things. And he said to us, I just love when I come to Stanton because it's the very first place that I saw my daughter's heartbeat on the ultrasound. I was like trying to hold back the tears and didn't do a very good job because I was so touched to see that we helped this young man, and he felt confident to be a father and was getting the resources he needs to be a father, and so his little girl's going to have a chance at a brighter future because of that support system. And so it was encouraging to see a young dad really step up to the plate like that too. So
absolutely.
Yeah, that's awesome. So this is all at your clinic on State Street here in Boise.
Yes.
But you also have a mobile clinic that you are bringing to the Boise State football game next week on September 9th.
We are.
September 10th. And so can you just talk about what that is and what is your goals for student awareness about your clinic?
Yes, so we are officially launching our Stanton BSU initiative, and we're really excited. We've actually brought our mobile out to BSU before. We kind of trialed it a couple years ago, and we're now officially launching. And our heart is to bring our 36-foot Class A RV. It's our Stanton Mobile Clinic. It's been converted into an actual clinic. The back bedroom has a portable ultrasound machine and an exam table, and all the drawers and cabinets are stocked with a variety of things, and our nurses staff it and our volunteers. But part of what we do with our mobile is also just create awareness, and we are doing a tailgate, and it's kind of a big mobile billboard that we're going to have parked out there, and we're going to have volunteers out there. We already have students that are going to be out there. In fact, we have right now a couple of student interns that are BSU students that intern at our clinic, and so they're going to be a part of it. And it's just a way for us to create awareness and to build unity and to make sure that students on campus here at Boise State University know that there is a place they can go to, a confidential place, a professional place, and a safe place where they're going to get tangible help and resources. if they're facing an unexpected pregnancy and they need some support. And so that's our goal, is to build a coalition with already existing student groups, to work with the student leadership here on campus, to build those relationships and be a valuable resource on campus.
At no cost.
At no cost.
Most students are starving.
Yeah.
So this is a great resource for them.
Yeah.
So you'll have food there, is that what you're saying?
There'll be plenty of food.
And, yes.
And so we're excited. It's going to be a great time.
Awesome.
Yeah, so we invite students to come by, check it out. They can get a tour of the clinic, they can meet us, they can hear what we're about. Yeah, we really invite people to come check us out. Yeah.
So you mentioned partnering with students. What was the student involvement that you were partnering with, that you said?
Yeah, well, we're building, we already have some relationships established with already existing student groups like Students for Life, and a variety of different groups that we want to continue to build relationships with. We want to make sure that the Women's Center on campus carries our brochures, and we're hopeful that they will invite us to bring the mobile periodically throughout the year, so women can know that we're a resource. And especially at a public university, it's important that services are presented to students, and that there is objective, everybody has different views on different topics and how things should be handled, but at the very least, having Stanton on campus along with other resources on campus, that's true choice for students, And so we provide a very valuable resource, and we're excited just to continue to create awareness and make sure students know we're here.
That's right.
Yeah, so like you said, you're mentioning partnering with Students for Life. You're also partnering with a group called Inside Out in the Treasure Valley. Can you tell me what you're doing with them?
Yeah, we just love that organization, Inside Out, and we are partnering with them, with Inside Out. It's a wonderful organization, and one of the only organizations in the state of Idaho that is actively working to prevent human trafficking here in our state. And in fact, they're one of the only ones that works with the victims of human trafficking directly. And so Inside Out actually has a salon in Eagle, and they provide at no charge salon things for women that have been victims of human trafficking. They also are a resource. They give presentations to different organizations. They work very closely with the police department and different state agencies as a referral place for those entities to refer victims to. And also they go in and train these different organizations and different groups and agencies on what to look for. And so they actually gave us training. They came in and did a 2-hour presentation so that our staff is well equipped to recognize a situation where a woman might be the victim of human trafficking. And we believe that we actually have seen that in our center. And it's hard to believe that even here in Idaho, human trafficking, sex trafficking is a significant issue. And so we're partnering with them, and we are going to actually use our mobile clinic to partner with them to go to different areas to minister to some of the vulnerable demographics, some of the homeless youth that can fall prey to human trafficking. And again, it's all about providing hope. It's providing non-judgmental environment to encourage people and to support them, and even the practical things of providing some important healthcare needs that we can address and help them deal with.
I think with the human trafficking, as Brandi's shared, you wouldn't think something like that would happen in Idaho, but that's why it is happening here, because it is under the radar. Yeah. And so we've already seen a few clients, and with that relationship we built with that organization, we had a precious young lady come in, 17 years old, pregnant. Family pushed her into human trafficking, and so she was able to come to our facility. We're able to provide those medical services and support and client advocacy, and you could see how she felt so safe being there and really cared about. And so, and that's what Stanton does. That's our mission, to partner with those organizations and to be a light in sometimes a very dark place in this world.
Yeah. Yeah, so I just wanted to talk about this a little bit briefly. Brandi, you were featured in Cosmopolitan June of this year, and the article is titled, "Meet the Woman Who Wants to Take Down Planned Parenthood." So how exactly were you contacted about this feature, and what's the idea behind taking down Planned Parenthood?
Sure, so it was really a big deal for our organization, and we've worked very hard to get to this place where we're making a tangible difference, that we would actually be featured in such a significant national publication. So we're very honored and very grateful for that piece that they did. So I was contacted by a reporter named Robin Marty. She reached out to me, and we did kind of a phone interview, phone conversation, and then learned more about our organization. She had kind of been following what we were doing for quite some time and following my work. And she said that she wanted to do a piece on it. She's a freelance reporter that's been an accomplished and published author on a variety of different topics and articles. And so she kind of shopped the article out to a few different publications, and Cosmo said, we want it. We want to do that story. And so they commissioned her and hired her, and they paid for her to fly out to Boise in November of 2015. She came out here, spent a couple days, toured our clinic, our mobile. She met she really wanted to observe day-to-day operations. She said, don't set anything up. You know, I want a real day at Stanton Healthcare. And so she got to see how things run at Stanton, what a normal day is like. And she got to meet several of our clients. We asked them, we let them know that, of course, everything's confidential, but we do have a reporter here. If you want to talk to her, she's available. And we had several of our clients, 3 of them, in fact, who said, yeah, we want to talk to her. We want to share our story and how Stanton's helped. So that was really neat. And she even got to sit in on an ultrasound exam. And so she wrote a fantastic article, a very significant feature piece on us that's really helped our organization kind of scale to the next level. We're going to continue to build off of that, because our heart really is to build off of what we've done here in Boise, Idaho, my hometown, and see this become a national and even an international affiliate model, so that there's Stantons all around the nation and all around the world. So that's kind of how that came about. And then it was, she worked on the piece for quite some time, and then it was finally published in Cosmo in June. So it was pretty exciting. And she did a really beautiful job painting a picture of who we are and what we do, and our heart just to help women and families.
So I read the article, and in it talks about the Stanton Revolution. Can you just talk about what that means to you guys?
Yeah, sure. The revolution in women's healthcare, revolution in healthcare. We believe that women deserve the absolute best in healthcare, and we are creating something where there's a very high standard of medical excellence compared to some of the other centers and clinics in the area and around. We exceed everybody in our medical covering. We have a medical director who specializes in women's healthcare. We have a radiologist who oversees our ultrasound department. We have only trained RDMS sonographers that do our ultrasound exams. That means they have a 4-year degree. We have licensed nurses, and then any of our lay volunteers go through a very intensive client advocacy training program to become client advocates. And so our standard is very high, and we're proud that we're becoming actually a leading voice in women's healthcare. And that's the revolution. And you mentioned earlier briefly the title of that article, Meet the Woman Who Wants to Replace Planned Parenthood. And our heart is that unfortunately there's been a lot of funding that's only kind of going towards one choice, and we think women need access to more than just one choice, and that's true choice. They deserve other alternatives. And so that's what our heart is. That was kind of a hard-hitting title, and that's what Cosmo's supposed to do to get readers, to want to read it. But really what we're about, we're focused on what Stanton's doing and wanting to provide quality health care and to make sure that women have access to options and alternatives when they're facing an unexpected pregnancy. And let me tell you something, our approach is working. It's making a difference in the lives of women and in the lives of families. And so we're gonna keep going, because it's making a tangible difference. It's not just in theory, it's not just an idea, it's something that's actually working.
And what's amazing is we're doing this from a grassroots level.
Yeah.
We raise all the money privately, and we're not funded by the government. So we go out and reach out to people in the community, and they're fully behind what we're doing. And because of those folks and our volunteers, we're able to provide these services to our clients at no cost. which is huge for us.
Yeah. In fact, we're grateful. One of the largest grants we got was from the Morrison Foundation a couple of years ago, which helped us secure our building in Boise. And that was an $80,000 challenge grant, the largest challenge grant that they've ever given. And so the $80,000 grant is huge and significant, but even having that name, the Morrison Foundation, which is such a reputable name and foundation here in our community and our state, to have them endorse our work and support what we're doing is significant. And we have people who give $25 a month and people all the way up to the 80,000, and that's what it takes to build a viable nonprofit organization, and that's how we keep our doors open to women, is by the people who support us financially or volunteer with us or just endorse our work. And even something like this show, that's just simply creating awareness. I mean, that's a wonderful thing for us.
So you mentioned fundraisers and stuff, and you told me a little bit about your baby bottle drives. Can you talk about this a little bit and how that's helping you?
Well, our Baby Bottle Drive is a program that we use to raise significant money, again, to keep our doors open. We're able to partner with churches in the Treasure Valley that allow us to come in, present our organization to the congregation, and then in turn what we do is this really neat program where as parishioners are coming in, we give them baby bottles, and sometimes they know what's going on and sometimes they have no clue. And we basically present, and then we tell them at the end, if you like what you hear and you feel led to give, fill this up with change and cash and checks, and then we come back in a couple of weeks and pick them up. And we have several churches, many churches actually, that support this, and we do this program. And again, it's just a great way, again, to build awareness. We also are able to secure volunteers from this program, but also those dollars, again, to keep the doors open, to provide that quality health care.
Well, and even clients, we've gotten clients directly related to the baby bottle drives. We have one particular story where a family brought home 2 bottles from church that day, which, by the way, we do the baby bottle drives not only at churches, but civic organizations, businesses. One of the local hospitals, an employee brought one of the baby bottles, and all the staff helped fill it up and that kind of thing. And so there's a variety of different groups that can participate in the baby bottle drives. But this family brought home a baby bottle, and they filled up one and took it back to the church, and then they held on to the extra one and slowly trying to fill it. And a month or 2 later, their 18-year-old daughter ended up getting pregnant, and the young girl, she's given us permission to share her story, and she said she was laying in bed in her bedroom, just terrified, kind of freaking out that she thought she was pregnant, and she went and got that bottle off the counter because we attach a card to it that has a client testimony on it, and the client testimony was of a young girl who found out she was pregnant, didn't know what to do, went to Stanton and decided to place her baby for adoption. So the girl, this young woman, read it, and her name's Blair. Like I said, she's given us permission to share her story, and Blair read it, and she said she teared up and said, if that girl's strong enough to do it, I am too. So she had her baby and placed her baby for adoption after coming into Stanton. So that's the power, just a baby bottle, right?
Wow.
Yeah.
So it's actually your 10th anniversary of the clinic.
Yeah.
So what new things are you doing this year to kind of mark that anniversary?
Yeah, well, we're doing our big 10-year anniversary gala, November 4th. We're really excited. It's going to be a pretty big deal. And so, of course, that's our biggest fundraiser of the year, but really we kind of call it our Stanton Family Dinner. And we usually have about 650 guests that come together. We have our clients give their testimonies and share about what we're doing. And it's just a really beautiful night. And so we're looking forward to that. We have a lot of exciting plans for 2017 to, again, build off what we've done in the first decade of Stanton's work. And in fact, we're kind of calling our gala, the title of it, or the slogan is a decade of hope and compassion. And so we want to just continue to build programs and different things to provide as much hope and as much compassion as we can to women or anybody in need in this type of a situation. And so we're excited. This is just the beginning, and we've gotten contacted by a lot of different organizations on a local level and a national level that want to partner with us. And so we're excited for things to come.
So some of the new things to come are you're building a new facility in Meridian. Do you want to talk about that a little bit?
Yes, absolutely. I'm glad that you brought that up. That's one of the most significant things that we're doing is we're expanding our operations into Meridian. We are going to be building a 7,000 square foot life-affirming mega center, as I like to call it, from the ground up. And we're already in our current flagship center off of State Street. We do a ton in there, but we've already outgrown that that space. In fact, I got the boot. I got kicked out. I have other office space that I use because we're using every corner for our programs and for helping the women that we serve. And so we're going to be expanding into Meridian. We actually bought a piece of land, a lot of land out there in Meridian, and we've paid that off. And we are now launching our campaign to raise the money to build the building. We got our first $25,000 donation. But this center is going to be amazing. We're going to have a baby boutique. We're going to have a client classroom where we can teach budgeting classes and nutritional classes. And we're actually putting in a special flooring so we can also turn it into a yoga studio. Cool. So we can do mommy and me yoga and prenatal yoga, which I'm really excited about. Fun. I want to become like a yoga instructor so that I can teach some of the classes. And so anyway, yeah, the list goes on and what we're going to be able to do in there. We're going to have multiple exam rooms so we can see more than just one client at a time for ultrasound exams and women's wellness care. We're going to have a donation drop-off area, kind of like going to the youth ranch or something, and we'll have a donation drop-off area and just more administrative offices, and it's going to be great. We're really excited.
And it's another place to provide that hope.
Yes.
And that's a big thing. So we're really excited. This new facility is going to be state of the art.
Yes.
And I think it's going to wow the people of Meridian and the Treasure Valley. So we're extremely excited. And
we're very grateful too. We have the support of Mayor Tammy in Meridian. She's very supportive of our endeavors to build this and is very excited that we're going to be building the center in her community. And we think it's going to be a model for the nation. We really do, because it's going to be state of the art, and we're strategically located there for a variety of reasons. And one of the things is that it's close to the interstate, and so for women that live outside of the Treasure Valley and maybe some of the more rural, underserved areas, it's going to be more accessible for them. So that's a really key thing, and that's really part of our heart too, as we mentioned with the mobile and with this new building, is making sure that women around the state of Idaho and some of those more underserved areas, because that's a problem, that's an issue, that we make our services that we provide at Stanton accessible to them.
That's great. I mean, we only have a couple more minutes, so if there's anything else that you wanted to add, something maybe we didn't discuss.
Yeah. I do want to just sort of share and make sure that the watching audience knows that one of the things that we're also looking to do at Boise State University is not only be a resource, but we want to work with the leadership of Boise State University, with President Custra and faculty and others, and maybe even lawmakers, and most importantly students, to make sure that if there is a woman on campus who is pregnant or already has a child, that Boise State is a campus that accommodates moms wanting to get their degree and further their education. And so we want to work again with the Women's Center. We want to work with Students for Life, leadership, students, and really sort of launch this Mothers on Campus campaign or initiative to make sure that it's a really comfortable environment for moms and that there's no stigma associated with that. And so we're going to be looking into that, and we're excited for that partnership and that initiative as well.
Yeah, well, thank you again for joining me. It's been really fun having you guys here. And to find out more information on Stanton, you can visit their website at stantonhealthcare.org. Thanks again to my guests, Brandi Swindell and Thomas Ditaranto from Stanton Healthcare, for joining me today. I'm Jamie Bingham, and from everyone here at University Television, thank you for watching. This program was recorded on September 1st, 2016 at Boise State University.